Hello, you're listening to Ovarian Cancer Connect. I'm your host, Dr. John Nakayama. This podcast is sponsored by AstraZeneca. Let's get started. Hello and welcome. I'm Dr. John Nakayama. Thank you for joining us for episode 1 in this podcast series, HRD What, HRD Why, Testing Your Ovarian Cancer Patients. In this series, we will discuss testing for homologous recombination deficiency, otherwise known as HRD, as well as why and how to test for this biomarker in your patients with advanced ovarian cancer. According to major society guidelines, all patients with ovarian cancer should be tested for germline and somatic mutations. BRCA mutations are found in approximately 25% of patients with advanced ovarian cancer. However, further information can be obtained with additional testing. If you do an HRD test, you will find that 50% of patients with advanced ovarian cancer have a deficiency. That's twice as many patients if you just test for BRCA alone. Knowing the HRD status of advanced ovarian cancer patients can provide important prognostic information related to the biology of the tumor and guide important treatment decisions. It also helps ensure that patients are not missed in terms of appropriate targeted therapy based on the outcome of the HRD test. As of the end of 2021, there are 4 tests that measure some aspect of genomic instability. This includes Foundation 1 CDX, Caris Molecular Intelligence, and Tempus XT testing, which all look at loss of heterozygosity, commonly referred to as LOH. Myriad MyChoice measures LOH as well as other measures of genomic instability. It's a common misperception that ordering a gene panel test will include testing for HRD, so it's important to make sure that your test of choice in fact does. It's also important to note that HRD is clearly distinguished from other biomarkers found in gene panel testing. Some of these are tumor mutational burden, microsatellite instability, and PD-L1 testing, which do not influence homologous recombination deficiency. In summary, not testing for HRD can result in missing important prognostic and predictive information that is critical to inform your treatment decision for patients with advanced ovarian cancer. Coming up in this podcast series, we'll discuss the practical aspects of genomic testing in your patients, including its purpose, how we have successfully implemented testing in our clinical practice, and how we communicate the value of HRD testing to our patients. Thank you for joining us for these podcasts, and we hope that you will find this information useful in your clinical practice.
This program is intended as educational information and is not intended as a complete list of available testing options. AstraZeneca is not responsible for any test provider and does not endorse any particular diagnostic test. The accuracy and results of diagnostic tests vary, and AstraZeneca shall have no liability arising from such testing. Information provided herein should in no way be considered a guarantee of coverage, reimbursement, or patient assistance. Providers should contact third-party laboratories for information on their patient assistance programs. While diagnostic testing may assist providers in identifying appropriate treatment for patients, the decision and action should be decided by a provider in consultation with the patient. All products are trademarks of their respective holders, all rights reserved.